events like today and approaches like listening to action have just really harnessed all of that potential of our staff, focused it and got them inspired to make change happen.
People have recognised now that when they have an idea and they come into this kind of forum and create these teams, the big impact is, wow, these changes are sticking. You know, these ideas have got people are listening and we're doing what we should. Listening to action, it's kind of does what it says on the tin.
This is where we started back in December 2014 when we kicked off that first round of big conversations with the 6 big conversations held trust-wide. And it's just grown and grown and grown, and we've grown from 350 to be approaching 2,000 by the end of wave 5.
If you send an email at 9 o'clock and you're going to send it to all staff, trust me, it really is different to sending it at 5 o'clock. Where we're not there yet is getting the message out where people are working, because in fairness, you know, looking around in the uniforms in the room, I only have a boss to serve, but I have a desk and a computer in fairness, and I talk a lot, but you've got patients. So you know, you've come out of your clinical areas, which is fantastic for us, but we need to be taking the message to you.
I'm sure all of you are aware that, you know, there's a high percentage of our patients that are over, you know, the age of 75, 85. And what we want for that, you know, that generation, you know, my mum's in that generation, I hopefully will get to that generation myself, is to avoid them hospital admissions. But if they do come into hospital, what we do want them to do is turn around our patients as quickly as possible. Today was just to showcase what we've done really in the last 12 months. We've got the care of the elderly team, and we've got a specific geriatrician that is really instrumental in taking this forward. We've introduced a new acute frailty unit, which has seen a reduction of length of stay. He had between length of stay 4 days and 64 days over the 12-month period. And to date, he's been 98 days out of hospital, so it's working.
40% of NHS staff exercise fewer than 2 days a week. Actually, if you improve the health and well-being of your staff, of your people, you actually improve patient care. Patient outcomes are better when you improve staff. But a whole host of work's been going on through Nourish. If people look at the canteen menus, they're much more different. And it's not about doing an initiative, this is about people making changes for life and what we as an employer can do to encourage them.
We wanted better patient outcomes. We wanted to see if we could improve our SNAP data, which is the sentinel audit which we perform for every patient that comes through the door with stroke. We made some massive improvements. We've implemented a brain icon, so any patient that now comes through the door who have acute stroke symptoms, referral wise, if you put a brain on it, we'll pick that up in the morning and we'll go and see the patient and review them, rule them in, rule them out, put them on the right treatment. We need everybody within the hospital to come on board with the changes that we're making and what benefits that they can give to our patients, so what quality changes that we can make, that everybody can make, that will improve the outcomes for the stroke patients.
And when we're asking somebody to come and look at these patients quickly, actually we need the appropriate person to come and look at them quickly. So somebody with the core competencies to potentially manage an acutely unwell, deteriorating patient.
Today we've been showcasing and introducing the National Early Warning Scoring System, which was developed by the Royal College of Physicians to kind of provide a national chart for hospitals to use.
We wanted this change for about 3 or 4 years, and the Listening to Action came about as a good way for us to drive this forward and get it through within a 20-week period.
Swap the scores, shout the score out, and whoever gets it first.
First person to get the right score gets some sweeties.
SpO2 is 96% on room air.
We'd like some competition going on.
Temperature's 36.4.
In January, only 36 RGNs, 52% of our workforce were able to cannulate.
In October 2015, we had 52% of staff able to cannulate on the ward. In June 2016, we now have 83%. Our goal was 80%.
A lot of people have come up to us today and said, we didn't know this work was going on. Well, yeah, we've done the work behind the scenes because we've got other things to do on the ward. But now it's a fruition, it's come to fruition, and we're going to carry it forward.
Days like today are really important because it helps showcase our event, showcase what the research team's been doing, and helps get the word out and help people out and about spread the word for us.
We were really lucky today because we had the Academy of Fab staff who arrived to have a look and listen to some of their schemes as well, and they've been around all the marketplaces.
Don't go home and flop on the sofa at night and say, I've done a lot of work today and I'm exhausted. Ask yourself, how do I know? How do I know that what I did today was the best that could be done? And you'll only find that out by looking and sharing and being a champion for best practice. So always be a champion.
Our scheme is about the start of a patient's inpatient journey. So from the point of being listed by a surgeon to having the pre-op. So ENT are using the new form, pain management are using the new form, and urology are using the new form at the moment.
Developing a safety culture within the theatre environment became our mission.
We'll work through all the patients that we've got scheduled to do that day, and we'll work through the list order, what the anaesthetic plan is. I won't list them all, but essentially everything that makes up a safe operation. And then we're going to score them with the traffic light system up in the corner. So if it's a red, we can't proceed until we've actually rectified that issue. We had a big conversation with about 70 staff there, really high quality information that we got from it, and which effectively shaped the process for this, the whole project really.
Patients not receiving the meals, again, meal gone missing.
Our project is to turn the meal ordering system from paper to a digital system using iPads.
Patients had ordered meals on other wards, and then they'd moved and we'd rung up and ordered a new meal for them on this ward, and that message hadn't been relayed to the right person, so it hadn't gone on the trolley. And
thanks ever so much. It's been an absolutely terrific day, and I think you stand there, me and Aaron are going to give you all a big round of applause from the executive team.
Fabulous second event. It's one of 3. We've got our next one next week in Barrow, so this is a series of 3 on every site within UHMBT.
They are a great opportunity for us to display the work that colleagues have been on with for the last 6-12 months and really tell a tale about how that's made improvements for them and patients. And it's also a bit of a motivator. You know, you'll have sensed the energy in the room this morning, so it gets people up on their toes, people are chatting about it, they broke for lunch and wanted to talk about the next wave of improvements. So that they're massively important, and they have a real impact in what we do.
It was fantastic to see how people are moving forward with their projects. When they start, it's too big, but they are narrowing down to be able to complete it within 20 weeks. And what they come up, the presentations were fantastic.
Events like this are so important because it's about sharing best practice, and you know, it's not only sharing best practice across the whole of the wider NHS, it's about sharing best practice within the organisation, because some of these organisations are so big, people don't get the opportunity to talk to each other and see what good things they're doing.
Today has been inspirational. We've heard stories of great people doing great things every day, improving patients through simple changes that they've just gone ahead and implemented through LIA.
I use the LIA process all the time now when I'm trying to improve things within my division.
I really feel like I can make a difference to our patients.